Welcome to Startup Health Now, the weekly webcast that celebrates the healthcare transformers and changemakers reimagining healthcare. My name is Unity Stoakes, and today I've got an exciting conversation with two healthcare transformers, Rebecca Norlander and Rachel Lanham. We're going to be talking about their journey in building Health123. Stick around, it's going to be a great show.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Good, so we're here with Rebecca and Rachel from Health123. It's great to be at Health2L with you guys.
Yep.
So just to sort of frame the discussion, maybe start with the vision and mission of Health123, so people know what your mission is.
So I think ultimately what we want to do is create a system that allows people to be a little bit more self-sufficient in their own health and wellness. Health is such a frightening thing today, whether you're well or not well. Figuring out what you need to do when you need to do it in a way that where you feel autonomous, you feel like you can live your own life is tough. And so a lot of people just don't do it. So our solution has really focused on how can we help people around self-efficacy in health and wellness, whether they're well and they want to feel better or whether they are not as well and they need to take steps towards recovery. And we believe that part of that is not just putting a digital tool out there for them to use, but connecting them back to a human element, somebody who cares about them but who also holds them accountable and can help them work through their overall process.
Would that be their doctor or caregiver?
It could be the doctor. It could be a caregiver. It could be any one of the number of care managers that are popping up in systems. And there are a bunch of kind of smaller primary care units that are popping up that focus on having a doctor, a nurse, and some kind of wellness coach that are really attacking people's everyday health and wellness. And that's where we've had the best sweet spot in terms of selling with our product.
Great. So you guys are based in Seattle. What's the genesis of how you guys linked up and really started the company?
Yeah, so we were introduced by a mutual colleague, and so we're in Seattle, and Microsoft is based there, and the company I used to work for was bought by Microsoft, and Rebecca worked at Microsoft for 19 years. She's been building platforms forever, and I worked for a company that included an ad agency called Razorfish, and I worked with Weight Watchers for almost a dozen years, helping bring their online product to market. And then we had a mutual colleague that ended up crossing paths with Rebecca and had Startup Capital and Health123.com and introduced us.
Had the domain name?
Yep.
Yeah, and we just both,
ideas.
for different reasons, have a passion for helping people be more healthy and take ownership over their wellness. And so we started off.
So was there an aha moment where you guys were sitting together brainstorming an idea? Did you see a big need for a particular problem at the time?
Well, so we kind of went off to the races and built some tools to help people understand their health and make small changes to improve it. That's always at the core of what we try to do. And once we kind of had a tool and did the friends and family and all of that testing, we thought, okay, business model, where who pays? And we did some piloting with small companies, kind of as a wellness solution. And I think through that piloting was our biggest aha, which was that when it comes to wellness, a lot of times the people who get engaged are the well people. Mm-hmm. And the people who really need help are generally already working with their doctor, and they don't necessarily want to work with their employer or feel like they're working with their employer on their wellness. And so they liked our solution, but they wanted to work with their doctor on it. And so we had an opportunity to kind of shift and start deploying our solution in one of those primary care type settings where there's a wellness coach. And that's where, and it also kind of circled back to Rebecca's background in platforms and mine with Weight Watchers, where there's this magic with someone to be accountable to and digital tools that are with you all the time, because you can't be with that accountable person all the time, and how all of that can drive better health and more accountability. So that's really, I think, our biggest aha was really at that moment where we threw something out there, tried to see what stuck, and said, well, if we really want to help people be more well, we want to foster that relationship through technology.
So how did you guys feel when you took that first step? Say, oh, we're going to be entrepreneurs, we're going to go do this. Was it a scary moment? Were you guys certain? What was sort of going through your head, and how did you feel at that time?
One of the things I always say to Rachel, and as a startup, you go through the most euphoric moments ever, and then the most depressing or demoralizing moments, and it can even be in the same space, in the same hour,
day.
in the same day. And I've never doubted that using technology to simplify people's health, to connect them to other people that can help them. I've never doubted that there's a ton of merit and a lot of different space in that idea for technology to play a role. Technology has to be a tool, and it really has to be about the people. So when I think about what we're doing, whether it was in the very beginning where we were just testing some ideas, or now that we've really focused on a segment of the population that so desperately needs kind of the digital extension of follow-up care in between their office visits, we're inspired to help people feel better. I mean, why is that a bad thing? You can do it with all different types of things, and we believe that there's a technology underpinning, especially since everybody's always attached to their phones. But I don't doubt that what we're doing is going to happen. And when we are feeling low, we just go back and think, okay, let's remember what we're doing and who we're doing it for, and the delight that we've heard from some of our customers and the testimonials that we get when people deploy the product. And that kind of keeps us from falling too far off course or from being too scared.
How important has it been having that co-founder partnership relationship to sort of turn to when you're going through those roller coaster hours or days?
Thank God. I cannot imagine founding a company without a strong co-founder. It's funny, Rachel and I didn't know each other going into this endeavor. And we had heard so many, even before we started this, we'd heard horror stories about what can happen between founders. And, on our best days and on our worst days, luckily we often kind of rotate between who's in the good and who's in the bad. So we've been a really great yin-yang, but I can't imagine doing it without a strong co-founder like Rachel. We're very complementary. We're brutally honest with one another, but I also trust her with my opinions, with the company, with the capital, with the customers, with everything. So I think that that's one of the best parts of the overall journey.
Yeah, you always hear how lonely it can be to be a startup founder. So whenever we're part of a group of CEOs, female CEOs in Seattle, and whenever I see someone in a hard time, I'm like, you need a co-founder, because
Right.
it really is, what really has kept us going for sure.
What advice would you give maybe to other entrepreneurs that are looking for a co-founder in terms of what to look for? You mentioned someone who complements you.
Mm-hmm.
Yeah, I think that's right. We kind of know where one begins and the other ends. We had the conversation after like playing around a little bit with the friends and family stuff, like one of us is CEO and one of us isn't. And so we're not going to agree all the time. And so we had that conversation, and Rebecca became our CEO, and that's worked. But we're not afraid to have the tough conversations. And I think, we have lots of work experience, so that might be part of it. But I think you said, what advice would you give, is to find someone that you can have really frank conversations with from the beginning, because that won't all of a sudden happen. You have to be able to do that right away. And then I think, the complementary skills. But I think that's typical. Usually you have a hacker and a hustler, or what. You usually bring two people together that are different skill sets. So I think it's more about, it's hard.
Yeah.
So you better be able to be honest with one another in a way that's not offensive.
And we had a crazy conversation really early on, which I think a lot of people miss out on. And I think this is actually something that we lucked out with because we have a lot of work experience. And we sat down and talked about what was important to us. So I think one of the things that happens in a lot of startups startups is not only maybe two people are too similar and they don't have complementary skills, but they're actually aimed at different things.
Your core values.
Exactly. If one person wants to buy an island and the other person wants to save the world, those two things are going to get you to a position where you have to make a decision and your core values are not aligned. And that's when people really clash. And so we had this this was actually one of the ways we knew we could be super honest with one another, because we said, well, what are your goals and what's important to you about what we're doing and how we're doing it and who we're doing it for, and where you draw the line with different decisions. And we did that early on, and I wouldn't replace that for anything. If she had said, I want to be the richest person in the world, I'd be like, well, that's great. I don't know. I mean, I want to do well. This is not a charity, but at the same time, I want to be able to make decisions along a similar axis of values.
Wonderful. One of the things we've been thinking a lot about at Startup Health is how to activate more women leaders to be building startups. And some of the conversations we've been having here at Health2O, I think there's like 6% of the startups today in healthcare getting funding are led by women. What's your experience been just building your company as a woman, and what advice would you give to other women coming into the space to maybe activate more women to move into healthcare?
Wow. Tough question. On the one hand, it's hard to answer because we've always been women.
Right.
And so saying, what is it like to be a woman? You're like, well, I don't know. This is what I do. Having said that, tongue in cheek, I've spent a long time in the technology industry trying to encourage more women and girls to participate in STEM careers and in technology careers. And I would say that in a startup world, especially in the healthcare startup world, and I'm not sure it's different with fintech or some of the other types of startup spaces, there is a dearth of women, and it's tough because you don't see a lot of people who look like you, and there are expectations that are different. People expect that you're not going to be as good or as competent, so you have some things to overcome. Again, I go back to why it's really important to have a strong co-founder and somebody who can be like, wow, I can't believe that that person said that ridiculous thing to you based on your gender versus what you've actually shown that you can do. But we just kind of have to get over it, so we have to go ahead and do it. The CEO roundtable that she talked about that we participate in has been great because we do hear other people.
Is that just based in Seattle?
It isn't just based in Seattle, but there are a lot of them. I just spoke to a woman yesterday who's a CEO and co-founder of a company in Portland, and they have at least 2 different groups in the Portland area that support women founders and co-founders, not just in healthcare, but in technology-based companies and startup companies. So I think if you look around, whether it's online or locally, you'll find a bunch of support groups. And I'm a little bit loath to say support group. I'm not a big coachy, supporty type person. But you do need to know 2 things, that there are other people that look like you and have been successful, because it does happen and it's great. It might be a little harder, but what's if it's not hard, is it fun? Then I don't think so. And if you want everything to be easy, don't do a startup. I don't care if you're a man or a woman. But the second part of that, outside of having support or whatever, is you have to accept the challenges that you have and move forward and overcome it. And you have to, as a woman, something we don't do particularly well, I hate to be gender biased, ask for help. Ask for help, and ask for a variety of help, not just from other women, but from men and from people who have done it and from unlikely sources. Rachel and I have gotten really good at going to anybody that we pitch to, whether they give us a yay or nay, and saying, okay, so what could we do better? No, really, what could we do better? And so, or when we're struggling with a business problem, like I had a conversation with someone today where she looked at a bunch of things we're doing, and she just kind of cut to the chase and was brutally honest about some things. And we kind of laughed later and said, yeah, we knew those things. That's great. But it's hard to say that yourself. So get that feedback, ask for that help. Don't think that you can do it alone, because you can't. And I think that that's more true for women. I don't think anybody can do a startup alone. But I think a lot of women get to senior positions by doing a lot of things themselves. Not going to happen in the startup world. You've got to ask for help.
So you guys are doing really well with Health123. You just raised a round. What's next for you guys?
We're just trying to get our platform into the hands of more people. So we're early stage still, and we have some great deployments, and we're just looking to mainly focus in the Northwest. So we're just looking to expand and get more data and hopefully help people be more healthy too. So we're really in that growth stage.
And
We really
is your
need to amplify.
strategy,
Yeah.
are you going direct to consumers? Are you using channels? Are
No,
you?
we sell to providers that are kind of already made that transition from volume to value, and they're providing follow-up care in some way, whether it's coaching, as Rebecca had mentioned, or a cancer nurse navigator, or in one of our cases, it's a transplant coordinator, but somebody who's following up with the patient, and we just help digitize that, because most of these people have, spreadsheets and telephones, but not really good platforms. So we're direct to provider right now, and then looking to hopefully develop some channels, people who we sell to, so we can expand more quickly.
Yeah, wonderful.
Yeah.
One of the things I love about Health123 is your design. Did you guys do that in-house? What was the process like in terms of really focusing on design from the beginning?
Yeah, I think that's probably more from my background in advertising and even my work with Weight Watchers. And I think a lot of times technologists are prone to add a lot of bells and whistles, because you can.
We like data.
Yeah,
we like
you
lots
can
of data.
attach lots of stuff and lots of buttons and whatever. And so our really number one focus has been to keep it extremely simple. And we have to make sure that we're doing that at all times. And so we have a very clean, but not very fancy UI, but I think that's what helps people use it. So from the care manager side, they're really busy, and it needs to just match their workflow, perfectly, and go, I know where to press, I know what to do next. And for the patient, we don't really want them staring at it like, what do I do? But like, oh, take my meds. Okay, took my meds, done. If they spent like 7 seconds a day with our tool, but did everything they needed to do within their care plan, we would be happy. And so that simplicity and minimalism is sometimes a hard thing to stick to, and that's really just always been our focus, is just to make it easy. People don't, a lot of times, I'm sure you've heard with most health and wellness related apps, the kind of longevity of using it is 3 months or less. And it's usually because of these bells and whistles. It makes people feel stupid. And that's not our goal. You want people to feel really empowered. So
Right.
it's always been a big part of one investor I was talking to today said, well, why do you white label for your customers? Because we love your brand. And I'm like, I love my brand too. But, the relationship for the patient is with their provider. And so we always white label. And it's, again, that's another reason to be clean and simple. So it looks good, whether it's our customer, Vera Whole Health, or a different customer, it always looks really good. But yeah.
And I think, to give Rachel some credit there, again, we had an upfront conversation around things, tenets that were really core to our brand, even though we weren't going to go around saying Health123 all the time, where we can go back, and from a design perspective, we can ask those questions and make sure that we're thematically on point. As a technologist, I'd have lots of data and graphs and stuff all over the place and integrate this and that and the other thing. And we can do that, but the way that you present it to someone has to be usable for them. And so she's really helped set that tone up front, and then kind of kept that as a metronomic heartbeat throughout the process.
So if you were each to share one piece of wisdom with other entrepreneurs just getting started, think back to when you guys were just getting together and pre-launch, what would that advice be?
One piece of advice. Well, we already talked about the importance of your co-founder. I think something that we've struggled with in the healthcare space is how quick is it going to move? How quick is that transition from volume to value? When does it become a top priority to follow up with patients outside of office visits, like the things that we support? And so really, I guess, ensuring that you have that product market fit probably is one of the most important things to be successful. And it's taken, I think, for us a little while for the demand to catch up with what we have. The timing's good now, but initially it kind of wasn't. So I think that's, spending that time to make sure, timing is almost everything when it relates to a startup. And so I guess that would be, no one ever told me that. I don't think when we got started. So that, and it's not something, you create something and then you try to sell it and then you kind of start to find that out. So to me, starting out, if someone had, told me to spend a lot of time in that area, I think it would have been helpful.
Yeah, that's a good one. I think what I would try to, and you can never actually understand this until you do it, I think what I would try to do for people is explain that it's going to be a roller coaster. It is the wildest, if you let it. I mean, I'm sure there are people that skate through it. I don't know how that would happen, but
I think it's a roller coaster.
but it's like it's honestly, it can be the most exhilarating and then almost the most debilitating moments of your life. But you're going to get through it. Have a little patience, have a little faith, have a great co-founder, and then enjoy every moment. Don't always be thinking about what might be in the future or what tomorrow is going to bring, because you're getting this amazing once-in-a-lifetime experience. No matter how many startups you're going to do, it's always going to be a little bit different. And so have a blast with it. Even when you think, ugh, have a blast with it.
It's true. You know, most people don't get the freedom to be able to do a startup. It's such a luxury in so many ways, such an opportunity. So I really like that. Well, thank you guys both so much. We love what you're doing, love partnering with you, and very inspired by all that you do. So it's great to work with you.
Thank you.
Thank you.
Thank you. This is
Feelings
great.
mutual.
Thank you. Thank you so much. We'll see you next week.